To my dear classmates and to our favorite teacher, Carlo Tala, good afternoon. I'm gonna talk about LPN specialty in hospice setting. LPN working in the hospice setting work for 40 hours a week. The starting wage is $24.76 in BC. As with the most labor union jobs in healthcare, LPN jobs also have benefits as part of the union contract, which include pension, vacation, sick time, and other provisions that would be similar but not exactly like those paid to be a registered nurse. The LPN provides comfort and optimizes the quality of life of terminally ill patients. Hospice LPN take and keep track of patients' vital signs, monitor catheter and dress wounds, and give medication. Hospice LPN can work in private homes, residential care facilities, hospital, and other hospice care environment. LPN is in demand job right now that they definitely have a future in this field, and it is very well respected career working side by side with the in charge nurse, so you are not your own boss, you are working in a team. Hospice LPN can change their field of medicine for advancement and become certified in specialties like IV therapy, gerontology, long-term care, and pharmacology. In order to become credentialed, classes or on-the-job training is required to complete the specific certification. Hospice LPN also choose to advance their career and become registered nurse through LPN to RN training programs. The LPN jobs do not enjoy the same level of remuneration as do registered nurses. This is reflection of the lower level of responsibility, decision making within the LPN nursing scope of practice. Hospice LPN take pride in knowing they are providing essential care to the terminally ill patients. Common ethical issues faced by hospice staff. Dying is no longer a matter simply between a patient and a physician. This is especially true in hospice, where there is a team effort among a patient, family, significant others, physician, and providers. In addition, there are a multitude of questions about how a person may die and a variety of treatments and technologies that are available. There is a great deal of room for ethical dilemmas as the hospice staff member interacts with the community surrounding the patient and deals with the needs and desire of a particular patient. In addition to patient-related concern, a staff member may face ethical questions involving work-related circumstances. The question of suicide, assisted suicide, and euthanasia. Working with patients who have been admitted without a DNR order, the question of whether or not to perform CPR on a patient who does not have a signed DNR order or an advance directive stating that the patient does not want CPR, withdrawal or withholding of nutrition, family decisions to prolong dying versus an incompetent patient's previously expressed views, patient autonomy versus patient safety and physical needs, the underdiagnosing of potentially treatable problems, confidentiality of aids, patient versus safety of visitors and caregivers, treating a patient on a ventilator, removing a patient's life support system, conflict with the patient's family or significant others, concerns that the nursing home facility is not providing adequate care for the patient, ethics of being judgmental or accepting, religious objection regarding the treatment or lack of treatment given to a particular patient, conflict over whether to follow a patient's wish to be discharged from a hospice unit when the staff member feels that the primary caregiver is incompetent to take care of the patient, family needs and nursing home placement, pain medication, respiratory distress, consciousness, the question here being whether the pain is so great that it is necessary to adversely affect consciousness and cause some respiratory distress by higher use of medications to suppress the pain. Is it better to control the pain or for the patient to be more alert? dealing with the request of a white patient to have no black staff caring for the patient at home. Any of these issues above can become ethical dilemma within the hospice program. Although the list is not exhaustive, it is fairly representative. The questions are what makes any of these issues an ethical dilemma and what is the most effective way of dealing with them. To take the second question first, there are several potential approaches. It is possible to ignore the conflict or dilemma, and this solution is one that is applied on a regular basis in all healthcare settings. The principle of autonomy. In end-of-life care, many ethical dilemmas are created as the result of a patient or family member exerting autonomy in the face of treatment options. Beneficence and non-maleficence do no harm. The principle of justice. The principle of justice is a little more nebulous than the other principles, but generally involves fairness. The principle of fidelity. In healthcare, there is a principle related specifically to truth-telling. One is not supposed to knowingly lie to a patient. Furthermore, to give consent, the patient must be informed of diagnosis, prognosis, alternatives, and possible consequences. Fidelity takes on added meaning and additional ethical challenge in the hospice experience. Conclusion. In hospice care, staff members are constantly faced with the possibilities and realities of ethical dilemmas. It was a game we all played as a child. Then some of us made it a dream worthwhile. More to learn, not as much time to share. Because in our hearts, we really cared. We have worked the late nights hours while others slept away, handles a doctor's many moods, then found a time to pray. Critical moments that remain as memories, some sad, then some are good. Then there are the tragedies that will never be understood. We see a newborn baby smile as we watch another slip away. And that completes the circle, the price for life that's paid. Sometimes not appreciated when just a hug will do. We are proud of our profession, a gift from me to you.
I'm a hospice nurse. Berta Olson is my patient. I spend long hours with her, checking her heart rate, administering her medication, and just making her comfortable. One night, Berta told me about a tradition in Denmark. When a person dies, she said, someone must open the window so the soul can depart. I smiled and squeezed her hand. Not tonight, Berta. Not tonight.